Hello, my name is Dr. Dewan S. Raja. Today I will discuss about pharmacology of fluoroquinolones. First of all, we'll go to the classification of fluoroquinolones. We have first generation, second generation, third generation, and fourth generation of fluoroquinolones. First generation, nalidixic acid, which is used less often today, has moderate activity against gram-negative bacteria. Second generation, very popular, still it is used to nowadays, ciprofloxacin, norfloxacin, ofloxacin. They have greater gram-negative activity, some activity against gram-positive bacteria, against atypical organisms such as Mycoplasma pneumonia and Chlamydia pneumonia. Third generation fluoroquinolone, getifloxacin, levofloxacin, moxifloxacin, and sparfloxacin. Effective against gram-positive cocci, gram-negative rods, Mycoplasma, and Chlamydia. Fourth generation fluoroquinolone include trovafloxacin, effective against gram-positive cocci, gram-positive bacilli, gram-negative rods, and anaerobic organisms. Okay, so we got the classification. Then what is the mechanism of action of fluoroquinolone? And how about the drug resistance? So multiple generations are coming because bacteria is getting resistant to the action of the antibiotic. We have to go through that part. First of all, mechanism of action. Okay, the fluoroquinolone enter the bacteria through porins. Porins are water-containing channels in the cell membrane. Once inside the cell, they inhibit replication of bacterial DNA by interfering with the action of DNA gyrase, topoisomerase II, and topoisomerase IV during bacterial growth and reproduction. Binding of quinolone to both the enzyme and the DNA forms a ternary complex, can cause cell death by inducing cleavage of DNA. So these are the mechanism of action. Now I'll go to the resistance, how this happens due to mutation in bacterial chromosomes and enzymes. Decrease accumulation of drug inside the bacteria. This may happen by altered porin in the cell membrane and also some reflux mechanism in the cell, bacterial cell that is developed that will expel or prevent the entry of the fluoroquinolone inside the cell. So, prevent accumulation and mutation in the bacterial chromosome and enzyme like DNA gyrase, topoisomerase IV. These are mutated. So, this is the way of bacterial resistance. Therapeutic application. This is a broad spectrum antibiotic, especially the second, third, and fourth generation, and we'll get multiple organism or system coverage like resistant respiratory tract infection, urinary tract infection, gastrointestinal tract infection, gonorrhea that is caused by Neisseria gonorrhea, an STD. This is STD, sexually transmitted disease, anthrax, anaerobic infection. The bacteria grow in less oxygen environment like Bacteroides fragilis that can be managed by the Trobafloxacin, there is the fourth generation, and moxifloxacin, third generation fluoroquinolones. Okay. Here, pharmacokinetics or oral absorption is 35% to 70%. Fluoroquinolone can be administered intravenously. Fluoroquinolone with the longest half-life, that is levofloxacin, moxifloxacin, sparfloxacin, and trobafloxacin, can be given once daily. You have to remember that sucral fat that is used in gastric ulcer or other intestinal ulcer, or in case of GERD, also in radiation proctitis, antacid, especially the chewable antacid containing aluminum and magnesiums, dietary supplement containing iron, zinc, can, and dietary calcium like milk or yogurt interfere with the absorption of fluoroquinolone. Okay, so we can get that. Okay, so zinc and dietary calcium like milk or yogurt interfere with the absorption of fluoroquinolone. So yogurt may prevent more in the process of absorption than that of the milk. Milk causes prevention, so better is to take the drug with water always. Okay. So we got that metabolites appear in urine and also in the bile. You must remember that fluoroquinolone should be taken on an empty stomach, usually 2 hours before meal or 2 hours after meal, with plenty of water, like at least 6 ounces of water. Adverse reaction: gastrointestinal, nausea, vomiting, diarrhea. It is seen around 6% population. CNS problem: headache, dizziness or lightheadedness. Precaution should be taken to a patient who has epilepsy, who are taking anti-epileptic drug. Phototoxicity: so person taking fluoroquinolone should not go outside in the sun. They should have some type of protection, okay, against the sun. Nephrotoxicity, that is also possible. Liver toxicity, especially by the fourth generation fluoroquinolone trobafloxacin. Connective tissue problem with all type of fluoroquinolone may cause articular cartilage erosion, should not be given during pregnancy. It may lead to arthropathy. It should not be given during pregnancy in a lactating mom or a child under the age of 18. It may cause tendon rupture, any tendon. This is the largest tendon. This can be ruptured, tendoachilles. Then person cannot move the foot, cannot walk smoothly, may fall. Prolonged QT interval and arrhythmia may be found with sparfloxacin and moxifloxacin. Okay, like that of third generation fluoroquinolone. Okay, drug interaction, that is very important to us to remember that sucral fat, again we just discussed, this is a drug used to manage stomach ulcer, to prevent GERD, also the radiation proctitis. Oral antacid containing aluminum or magnesium, the chewable antacids, and cation like supplement of some cations, milk or yogurt, fluoroquinolone absorption is interfered. Okay, so this should not go with that of fluoroquinolone. At least 2 hours difference should be present. Theophylline is an old anti-asthmatic drug, may cause convulsion and severe arrhythmia. Third and fourth generation fluoroquinolone may increase serum levels of warfarin, and this is an anticoagulant. Caffeine that is always present in your coffee or tea. Okay, and cyclosporin, this is an immunologic anti-immunity medication, also used some type of cancers, some skin disease, some allergic diseases. So this drug may not go good with that of fluoroquinolone because this drug's serum level is increased. Cimetidine is a H2 receptor blocker. This is an antacid. Okay, market name Jantac. Okay, prevents the elimination of fluoroquinolone. So these two drugs should not go hand to hand. There should be gap between these two drug intake. And that's all about the pharmacology of the fluoroquinolone. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.